To prevent cavities in children. What is tooth decay in children? Tooth decay is the breakdown or destruction of tooth structure caused by bacteria-generated erosion and leads to cavities or caries, which are essentially holes in teeth. What causes tooth decay in a child? Tooth decay commonly happens when food containing carbohydrates, sugars, and starches are left on the teeth. Such foods include milk, soda, raisins, candy, cake, fruit juices, cereals, and breads. Bacteria metabolize these carbohydrates and produce acids. The combination of bacteria, food, acid, and saliva form a substance called plaque that sticks to the teeth. Over time, the acids made by the bacteria erode tooth enamel and can progress into the dentin layer, causing cavities. The following factors increase the risk of your child having tooth decay. High levels of the bacteria that causes cavities, example S. mutans, a diet high in sugars and starches, especially soda pop. Water supply that has limited or no fluoride in it. Poor oral hygiene. Less saliva flow than normal. Lower pH saliva, which is more acidic. What are the signs of tooth decay in a child? Chalky white spots that represent decalcification of the enamel begin to form on the teeth in areas affected. This may lead to early sensitivity in the teeth. When early cavities appear on the tooth, it has a light brown color. The cavity becomes deeper. It turns a darker shade of brown to black. The symptoms of tooth decay and cavities vary from child to child. Cavities don't always cause symptoms. Sometimes children don't know they have one until their dentist finds it. But your child may feel the following: pain in the area around the tooth, sensitivity to certain foods, such as sweets and hot or cold drinks. How is tooth decay diagnosed in a child? Your child's dentist can usually diagnose tooth decay based on a complete dental history of your child, an examination of your child's mouth, dental x-rays. How is tooth decay treated in a child? Treatment will depend on your child's symptoms, age, and general health. It will also depend on how severe the condition is. In most cases, treatment requires removing the decayed part of the tooth and replacing it with a filling. Fillings are materials placed in the teeth to repair damage caused by tooth decay. They are also called restorations. Typically for children, direct restorations are used. These need a single visit to place a filling directly into a prepared hole. These fillings may be made out of amalgam or resin composites. Stainless steel crowns may also be cemented in place where there is substantial destruction of tooth structure. How can I prevent tooth decay in my child? You can help prevent tooth decay in your child with these simple steps. Start brushing your child's teeth as soon as the first one appears. Brush the teeth, tongue, and gums twice a day with toothpaste, or watch as your child brushes his or her teeth. For children younger than 3 years old, use only a small amount of toothpaste, the size of a grain of rice. Starting at 3 years old, your child can use a pea-sized amount of toothpaste. Floss your child's teeth daily after age 2. Make sure your child eats a well-balanced diet. Limit or eliminate snacks that are sticky and high in sugars, such as chips, candy, cookies, and especially soda pop. If your child uses a bottle at bedtime, only put water in it. Juice or formula contain sugars that can lead to tooth decay. It is recommended that you avoid bottle feeding your child after they are 1 year old. This will prevent orthodontic problems such as a narrow arch and anterior open bite. Talk with your child's healthcare provider or dentist about using a fluoride supplement if you live in an area without fluoridated water. Also, ask about dental sealants and fluoride varnish. Both are put on the teeth. Schedule routine dental cleanings and exams for your child every 6 months.